Angular cheilitis is a chronic infection of the lips that can occur on either side of the mouth. Symptoms are typically limited to the mouth but can extend to the cheek, which is why it's important to treat the underlying condition. The main treatments for this condition depend on the underlying cause. If you have a nutritional deficiency, you may need to take supplements, while if it is caused by a fungus, you can apply topical antifungal. If you suspect that you have angular cheilitis, you should consult your doctor immediately. This condition is not serious, and the treatment is generally easy to follow. However, recurrence rates can be as high as 80%, so you should take steps to prevent recurrences as soon as possible. Your doctor can also prescribe a topical treatment if you're experiencing symptoms. Angular cheilitis on lips can be treated with topical medication. In some cases, there are also prescription medications available. Depending on the underlying cause, the treatment may vary. If it's a nutritional deficiency, topical treatment is unlikely to work. In mild cases, however, the condition may be the result of trauma or eating issues. If this is the case, you can use miconazole oral gel to treat the fungus. Treatments for angular cheilitis on the lips vary. While it can be effectively treated, recurrence rates can be as high as 80%. Your doctor will prescribe a topical antifungal and prescribe oral medications if needed. If the fungus is persistent, you may want to see a dermatologist for further treatment. You can also use a steroid ointment on the affected area to help prevent future outbreaks. You can try over-the-counter medicines for angular cheilitis. These medicines are available over the counter, and will be more effective if you have an allergy to the specific drug. If the condition is severe, you should see a doctor. If it's a fungal infection, a prescription for an antifungal agent is necessary. Otherwise, topical medications may not work at all. Symptoms of angular cheilitis include redness, inflammation, and cracking on the lips. You may experience a pain and swelling in the area. You may lick your lips more than you normally do. During angular cheilitis, the corner of your mouth becomes inflamed and the affected areas become cracked. You may experience a sensitivity to saliva and a pacifier. If you're a baby, you may have an immune system disorder or chronic health problem that is causing your child to have this condition. If you have angular cheilitis, your doctor may recommend topical antifungal medications to treat the infection. These antifungal medications will work well for preventing the infection from spreading and causing more symptoms. You may also want to change your diet and avoid lip licking. Using petroleum jelly will prevent dry lips and reduce the risk of developing the infection. Aside from topical treatments, you should also visit your doctor if you experience any of these conditions. In some cases, angular cheilitis is caused by a bacterial infection. You can try using an antibiotic, but you should not try to stop taking your medication. You may also need a new one. Another possible solution is using lip balms and petroleum jelly. Both of these solutions are proven to help you treat angular cheilitis. A good diet will improve your immunity. There are many treatments for angular cheilitis. Inflammation of the mouth causes redness, swelling, and pain. Infections in this area are not life-threatening, but your doctor will likely prescribe a topical antibiotic if necessary. If these treatments are unsuccessful, your doctor may suggest a different option. In some cases, you may be able to treat angular cheilitis on your own. If the inflammation persists, you should contact your local physician. Besides treating the underlying causes, you should also consult a doctor if you are experiencing symptoms of this condition. In some cases, you may have a fungal infection, but if you're unsure, consult a dermatologist. You should also avoid using tobacco products, as they can make the condition worse. If you have angular cheilitis on lips, you should consult a dentist as soon as possible. If you suffer from AC and want to look normal again, click the link in the description below to discover a natural treatment for angular cheilitis. Thanks for watching.